Hello, welcome to Advancing Health Literacy, Improving Supportive Systems for Health Outreach Workers. This is the fourth module in a series of trainings brought to you by the New Haven HEAL Initiative. The New Haven HEAL Initiative aims to improve health outcomes for New Haven residents to reduce COVID related disparities and to increase patient engagement in their healthcare. To refresh your memory, health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health related decisions and actions for themselves and others. In our most recent training, we went over how to encourage questions, make action plans, help residents remember how and when to take their medicine, and get resident feedback. During today's training, we'll be going over a few tools you can use to improve supportive systems in the community. Tool number 18 is links to non-medical support. Limited health literacy affects not only residents' healthcare, but also other aspects of their lives. Linking residents with available community resources, such as assistance with transportation, food, employment, budgeting, and housing, helps residents attend to and maintain their health. Supporting residents in this way involves developing knowledge of the resources available in the community, directing residents to relevant resources, and following up to ensure that the connections were actually made. Attending to residents' non medical needs, critical for residents to achieve optimal health, is time well spent. Start by assessing each resident's needs and support system. Ask residents about things that may affect their ability to manage their health. You could ask a general question such as, is there anything in your daily life that makes it hard to take care of your health? Or you could ask questions addressing specific needs, such as, was it easy to get here today? Ask about and involve the residents' current support systems, such as family, friends, and social workers. Find out and record what role each member of the support system plays in the resident's care. Listen to what residents tell you about the challenges in their lives. Note residents' non-medical challenges in their records. Identify your community resources. One available option is to press 211 on your phone or access this resource on the internet. The Chamber of Commerce can also provide a list of community services. You can establish linkages with community partners. Ask specific agencies to send pamphlets or give a presentation at your practice. This provides staff with an opportunity to meet a contact person as well as learn more about the agency's services and the referral process. Create a system for organizing resources. Have one person take responsibility for organizing and updating resources and helping residents get connected. Keep your resources up to date. Ask residents to let you know if they cannot reach a community resource. Establish a schedule for verifying whether resource information is still accurate. Connect residents with resources. You can use a referral form to provide residents with essential information about recommended services. Follow up. Find out if the referral was completed by contacting the resident or the service provider. Certify a notary public. Select one person in the practice to become a notary public. This can help expedite completion of certain forms and eliminate an additional step for residents. You can also see tool number 21, Making Referrals Easy, for more information on supporting and following up on referrals. Remember to track your progress. Test whether your resource list is up to date. Call 4 randomly chosen service providers and verify their information. Conduct a spot check of your internal records. Choose 10 records at random to see if they record information about residents' non-medical challenges and support systems. Track how many referrals are made in a month and then again at 2, 6, and 12 months after implementation. Check the resident's records 1 month later to see if the outcome of the referral is documented. Tool number 19 is directing residents to medicine resources. Medicine is an important component of many residents' treatment regimens. Unfortunately, some residents may try to save money by going without their medicines or reducing the amount they take. Helping residents access low-cost medicines can support them in taking their prescriptions as directed. Start by assessing residents' ability to pay for their medicines. Ask residents directly about difficulty they may be having getting their medicines. For example, you can say, "It's sometimes hard to afford all the things we need. Have you gone without medicine or not taken your full dose because of the cost?" Let residents know you can help. Emphasize how important it is for them to take their medicines. Ask them to let you know if they have problems paying for medicines before they run out. Review residents' insurance coverage. If residents are uninsured, help them access the CT Marketplace, where they can apply for insurance, including Medicaid and subsidized insurance. Personal help in the form of navigators is available from most marketplaces. For Medicare residents, make sure they have Part D. Residents can get help enrolling in Part D from the State Health Insurance Assistance Program. When referring residents to navigators or the SHIP, follow up to make sure they have been able to connect. Connect residents with medicine assistance programs. Needy Meds provides resident assistance programs, drug discount cards, and a list of disease-based assistance programs. Partnership for Prescription Assistance offers a single point of access to more than 475 public and private programs. RX Assists offers a comprehensive database of resident assistance programs, as well as practical tools, news, and articles so that healthcare professionals and residents can find the information they need. RX Outreach is a nonprofit mail order pharmacy that offers prescription medicines to people who are uninsured or have limited prescription drug coverage. Select Care Benefits Network is a resident advocate agency working with low-income residents to help them obtain their medicines from pharmaceutical companies. You can also look into local programs and agencies that will give financial assistance for medicines. Track your progress. Track over time how many residents need assistance paying for their medicines and note the services that you provided. Ask each resident seen during the first week if they went without medicine or did not take their full dose. Repeat again after 2, 6, and 12 months. Note whether there have been any changes. Tool number 20 is connecting residents with literacy and math resources. Research has shown that clinicians have trouble identifying residents with limited health literacy skills. Residents are unlikely to mention limitations in their literacy or math skills unless you initiate a conversation about the issue. For these residents, referral to an adult learning center for literacy and math skill enhancement can be a life-changing event. Ask residents directly about their literacy skills. Using the Direct tool developed by the American Medical Association can make discussing reading difficulties with residents feel less awkward. Start by asking about difficulty reading. For example, have you ever had a problem with reading? Ask if the resident has an interest in improving. Would you be interested in a program to help you improve your reading? Have referral information for adults and family literacy programs ready to give to those identified with reading difficulty. Ask everyone about their literacy skills. Let residents know it is your policy to ask everyone. Emphasize that low literacy is a common problem and they are not alone. Half of Americans have some difficulty reading. Take down barriers to joining literacy classes, such as helping with an initial phone call, having informational sessions at your office, and making follow up contact with residents to see if they were able to find the right class. Connect residents to literacy and math resources. Identify community resources. Contact resources in your community to verify their services and how to make referrals. Regularly update resource information. Obtain or create an easy to read handout with information about joining a literacy or math program. Ensure the instructions are easy to understand. Offer help with the referral. Ask staff to help the resident by making the initial phone call. Document the referral. Identify a way of documenting referrals to literacy and math programs in your records and train staff to document referrals consistently. Track your progress. Check the records after 1 month to see if any outcomes of the referrals have changed. Tool number 21 is making referrals easy. Primary care practices refer residents to specialists, specialized healthcare clinicians, lab and screening facilities, and elsewhere. Making the referral process easy for residents increases the chances that they will follow through and that both you and the referral destination get all the information you need. Refer residents to clinicians who coordinate care with you. Identifying, developing, and maintaining relationships with clinicians to whom you refer residents can make the referral process run smoothly. Try to establish formal referral agreements with key specialist groups and other clinicians. Don't continue to refer residents to clinicians who do not send information back to you. Don't provide timely appointments for your residents or otherwise fail to coordinate care. Don't rely on residents to relay information. Share important information directly with the other office, such as the reason for the referral, pertinent medical history, and test results. Explore making electronic referrals. Provide a detailed referral to the other clinician that contains all the information needed. Get information sent directly back to you. Make sure you get a full report back before your resident's next office visit. Consider language barriers. When making referrals for residents with limited English proficiency, identify clinicians who are language concordant or have interpreter services. Include information on your resident's language assistance needs when making the referral. Make sure the resident understands the reason for the referral. Explain why the resident needs to be seen by someone else and what might happen if he or she is not seen. In the case of tests, explain how the resident might need that information for a clinician to diagnose, manage, or decide on treatments for health conditions. In the case of screenings, give a clear explanation of the risks and benefits. Ultimately, it's up to the resident as to whether or not to undergo any particular test or screening. Use the teach-back method and ask about and address any concerns or fears. Offer help with the referral. Ask residents if they would like your office to make the initial phone call. If staff members are making appointments for residents, make sure they first find out when the residents are available. Ask residents about transportation and other barriers to completing the referral. Discuss how they could overcome these barriers. Provide clear instructions. For some referrals, residents will need to prepare in advance. Provide easy to understand instructions verbally and in writing. Explain the referral process fully, such as how you and the clinician will exchange information and when the resident should return to your office. Give clear oral and written directions to get to the referral location. Follow up on referrals. Confirm and document that the resident successfully completed the referral. Obtain any information on the result of the referral and document it in their record. Provide residents positive feedback for completing referrals. Let residents see how you can use that information to help you with your work. If the resident has not completed the referral, reinforce that you feel the resident could benefit and review the barriers. Determine whether the resident may need additional referrals. Get feedback from residents on the quality of care provided. Stop making referrals to places that consistently receive negative reports. This concludes today's training on improving supportive systems. Be sure to try these tools out. This training is brought to you by the New Haven Health Education and Literacy Initiative, led by the New Haven Health Department.